I just did a virtual consultation on scar correction for hair transplant. I addressed all types of scars. I want in this particular video, first of all, I encourage you to have watched that video because I'm not going to repeat everything I just said there. But in this video, I'm specifically focused on how to correct strip FUT scars. So first I want to preface this, say that half of my business is still FUT or strip. I get incredibly difficult to see scars. I have an assistant that used to work at other places in Dallas, and he says, Dr. Lamb, it's the first time I've actually seen scars that look invisible. Because in the past, she was working at other places where the scars look bad. I create very difficult to see scars in the vast majority, and it's how I harvest it. So in terms of FUT scars, I typically have very hard to see. Now, not always, sometimes I get 3 millimeters, and I tell all my patients there's always a risk of a scar, but in terms of very wide scars, it's not that common for me to see that. But let's say we have a situation where you do have a wider scar. How do we fix that FUT scar, that strip scar? So one method you're going to hear about is doing a scar revision, and I do a ton of scar revisions. I don't do W-plasties, but I do geometric broken line repairs, Z-plasties, various other types of plasties to correct facial scars. But what's interesting is that hair scars back here act very differently. I have found that when you try to cut into hair-bearing tissue with scar and pretend it's not hair-bearing, like an eyebrow scar, a scar back here, that you try to close it with some meticulous technique and two layers, blah, 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 take off tension, undermine, not undermine, subgale undermine, etc. The scars don't heal well. For some reason, just traumatizing adjacently near other hair-bearing areas results in a return of the scar, sometimes improvement, but usually worsening or the same scar. So I no longer pretty much do scar revisions to correct, in other words, scar correction, scar revisions being surgical excision of scars, closures, as a method to correct hair-bearing scar tissue. I just don't think it's successful, at least not in my hands, but my colleagues, I think, that are very experienced with this would agree with that, is that scar revision, surgical scar revisions for scars and hair-bearing tissue is not that successful. So how do you fix it? Well, the way I fix it is I do transplants into the scar is my preferred method because hair to hair is awesome. In terms of survival, I encourage you to watch my virtual consultation on scar correction because I talk a lot about how grafts survive, but I get very good graft survival. We're talking specifically about FUT scars here. If there's a widened scar, the way that I would fix it is oftentimes with FUE transplanted grafts into the area. So I use a punch, which is a little round punch that removes out the scar tissue. So one, it takes out bad disease tissue and it replaces it with healthy tissues. And that's what I talk about my virtual consultation about how that scar tissue is now reformed and improved. So camouflaging with FUE grafts is really my number one method of correcting these scars. But sometimes the person really just had a bad scar because they had a bad strip procedure. So I may do another strip procedure, maybe another virgin territory, another place, and then I'll be doing transplants into the frontal scalp and then correcting the scar with the same method I mentioned, is taking some of those grafts allocated and placing them into the scar. So I may actually do a strip procedure to correct it. I may do FUE. It depends on your situation. Again, that's going to be a 30-minute discussion of how it fits you, but I just want to give you that basic principle, is that it's either FUE grafts or FUT grafts to place into the scar for optimal results. An easier method would be just doing a SMP or scalp micropigmentation, which is tattoo. So placing tattoos into the scar, matching the hair follicles, can be a great way to do it. Sometimes it requires both, sometimes just requires one. So how do I make the decision? Some part of it depends on your hairstyle and also what you want. A better result is no doubt grafts compared to a flat color. There's nothing better than having dimension. The SMP is less expensive, it's easier, you don't need a surgery or anything, you don't need to shave the back scalp if we're doing FUE to do it. It's an easy way to do it. If you wear your hair super short, like almost down flush to the scalp, then what I worry about is if I'm taking too many grafts from the FUE, that those could lead to white dots. So if it's a limited scar and I can harvest the sites for FUE very widely apart, your brain usually doesn't see white dots very far apart, but when they're clustered and very close together, there's a chance you could see those scars. So that's my decision. If you wear it super close to the scalp, I may just tell you SMP. If you're wearing it medium longer and I can harvest it over a very wide area, I probably would tell you FUE. But sometimes, but I always tell my patients if I do FUE, I may need SMP. I tell my patients doing SMP, they may need FUE, or they may need a strip, well, less likely, but a strip procedure, whatever it may be to fix the strip. So there are many ways to correct it, but the take-home lesson of this whole virtual consultation is that I don't believe that scar revision is a viable method in the vast majority of patients undergoing strip correction. I believe that a combination of FUE and SMP usually works the best, but one or the other method may be more applicable to you based on recovery, budget, desires, hairstyle, etc.